So this is another good day. We have another Sunday, another lecture in the series of renal medicine. And today we are going to look at a condition which is called Goodpasture syndrome. It's called Goodpasture syndrome. So, and in this content, we are expected to know various things as what is a syndrome, what is a Goodpasture syndrome, what are the causes and the risk factors, what are the symptoms, the initial symptoms, the lung symptoms, the acute symptoms. How do you diagnose it? How do you treat it? How do you prevent it? What is the alternative names of Goodpasture syndrome? And then finally, we will see what are the complications. So, what is a syndrome? So, in day-to-day life, people hear people talk about syndrome, and a syndrome is a group of symptoms which consistently occur together. Consistently occur together. It's like a pair, and as if they are found, they have to occur systematically together in a set. So that's what is called a syndrome. So it's a condition that characterizes by a set of associated symptoms like HIV/AIDS is a syndrome. So also a syndrome is a collection of signs and symptoms associated with a specific error-related cause. So what is a Goodpasture syndrome? Goodpasture syndrome is a rare potentially life-threatening disease. It's an autoimmune disease. It damages both the lungs and the kidneys. And some rare cases also it damages the ear. So it is also known as antiglomerular basement membrane, which is abbreviated as anti-GBM disease. The disease is common at 2 times of life. It is very common at the age of 20s, and again, it reappears again in the ages of 60s. So let us look at the pathophysiology of Goodpasture syndrome. So there is a abnormal production of antiglomerular basement membrane antibodies by the plasma cells of the body, examples the platelets. So these plasma cells produces antibody against the glomerular basement membrane, which the filtrate acts on the filtrate of the kidney. So these antibodies attack the alveolar and glomerular basement membranes, and the binding their reactive epitons to the basement membrane, and their reactive and they activate their complement cascade, and the complement cascade, especially the classical pathway of complement pathways inflammation, leading to a death of target cells resulting to a tissue damage or tissue injuries. Under normal conditions, the alveolar endothelium is available to the anti-basement membrane antibodies. However, with increased vascular permeabilities, antibody binding to the basement membrane occur in the alveolar. So T cells are also implicated in this phenomena, and the enhanced B cells functions and the antibody production, and they may play a direct pathogenic role in kidney and lungs. So it is generally considered as type 2 hypersensitivity. It is considered as a type 2 hypersensitivity. So, what are the risk factors to Goodpasture syndrome? People who smoke, people who have metallic dust or chemical exposure, people who inhale cocaine, people who have various lung infections like viral infections of the lung, and people who have the immune system medications, immune system medications. Causes of Goodpasture syndrome, sometimes the behavior like smoking, inhaling of metallic fuel, other conditions is like respiratory tract trigger immune systems, especially the viral infections of the respiratory systems can trigger the immune system. Other is exposure to hydrocarbons, fumes. Other conditions is like a viral infection of the respiratory system, metallic dust, smoke, from the tobacco, chewing, or certain drugs such as cocaine. It also occurs due to genetic factors. People who have a specific immune leukocyte antigen, which is known as DR15, is found in 88% of people who have this syndrome. So sometimes if you suspect the Goodpasture syndrome, the best way to diagnose is to do this immune leukocyte antigen DR15 to confirm whether the patient has it in most cases. So so the cause of the syndrome is syndrome develops a substance that attacks protein called collagen. The collagen is the one which holds the alveolus. In the lungs, they hold the alveolar species. In space, they hold the alveolar sacs in the lungs, and also they hold the glomerular in position in the kidneys. So the body produces antibodies, proteins which react against this collagen. Substances, antiglomerular basement membrane, and this membrane acts as a filter which filters the waste from the blood. Membrane damage usually to kidney damage. So if the glomerular filtrate is damaged, if the kidney is damaged, this one now results to kidney problems. So immune system fault like bleeding in the air sac of lungs and infiltration in the kidneys filtering human also result in this type of condition. In the kidney, there is an effect on the glomeruli, which is the filtrate in the kidney, which separates the bad waste from the blood, then turns and makes the formation of the urine. So if it is affected, there is a problem here. So in the lungs, it can affect the alveolar, and the alveolar thin sacs of the air, which where the gaseous exchange takes place. So the immune activation and inflammation then leads to the symptoms of the conditions. Abnormal activated antibodies are called antiglomerular basement membrane antibodies. So genetic also plays a role in triggering Goodpasture syndrome, people with certain variant of specific gene. And we have seen them, people with human leukocyte antigens. We have seen that one. So symptoms of Goodpasture syndrome include symptoms may be occur very slow over a period of time, many years, and often can also even occur quickly in weeks or days. So there is the initial symptoms, there is lung and damage symptoms, and there's kidney symptoms. Okay. So the initial symptoms, there is loss of appetite, fatigue, weakness, nausea, and vomiting, unhealthy, and patient can appear also pale sometimes. Can appear pale sometimes. So in the lungs, there is coughing of branch hemoptysis because of the destruction of the collagen which owns alveolar species in case. That means if the collagens are destroyed, the micro blood vessels in the alveolar species are destroyed, resulting in alveolar species, and this can result in blood in the hospital. There can be a dry cough, shortness of the breath, respiratory failure, chills and fever, and also fatigue and shortness of the breath, and sometimes chest pain. So in the lungs, in some cases can cause severe pulmonary hemorrhage. Again, we have explained that one is because of the particular species, because the collagen have the which of them is inflamed. And again, the collagen, the largest tissues are also inflamed like blood vessels, leading to what the bleeding. So this can indirectly lead to anemia, hemorrhagic anemia, which can lead to red blood cells low count. If more severe blood may block the exchange of oxygen in the lung sacs, this may cause respiratory failure. And this is a rate-limiting condition which because the body does not receive enough oxygen. So kidney symptoms. The kidney symptoms, the patient can have bleeding in the urine. This is because again the collagen which holds the basement membrane or the glomeruli in peace get attacked secondary something like hypersensitivity, secondary hypersensitivity. Then there is inflammation process and reason results to that problem of inflammation there is something to relate in the urine. So there's burning sensation when passing urine. The skin can peel because of loss of blood in the urine and also elevated blood pressure reading. This is because of kidney failure to regulate the blood pressure. There is swelling, back pain below your ears, that's the kidneys are, nausea and vomiting, increased blood pressure, back pain, and also fatigue, itchiness, confused thinking, and sometimes a seizure. So again, kidney symptoms, they can lead to a condition called glomerulonephritis. This is inflammation of the nephrites. nephrons and the glomerula that can refer to infection space part of the kidney from the glomerula. So if a kidney problems are severe, it can lead to uremia. There is accumulation of uric acid in the body, which can be toxic, and it is arrive written in the body. So the mechanism of antiglomerular basement membrane is that you can see the efferent, you can see the efferent, you can see the glomerular, so the glomerular basal, and the capsule above the capsule, there is glomerular basement membrane. Then there is anti-glomerular membrane antibodies. There is the antibody antigen complex reactions resulting to activation of complement system, especially the classical pathway of the complement system, resulting to the classical pathways of complement system. So these immune complexes disease result to vascularitis of the blood vessels around the glomerula. And also, and you remember that the glomerular blood vessels are very minute, they are very minute, and they have another way, they have another very unique perspective that there is arterial anastomosis instead of arterial capillary vein. In that glomerular, it's a very unique where there is anastomosis. So this one also results antibody antiglomerular basement membrane glomerulonephritis. So in the lungs, you can see the bronchioles, the capillary gaseous exchange. So in this capillary, if there's inflammation inside there, and there is bleeding here, so that means there is no way that the exchange and gaseous exchange can take place. So this is then the neural capillaries. You can see the glomerulars, the basement membrane, resulting in glomerulonephritis. So Goodpasture syndrome occur along with other conditions called autoimmune ear infection, which is very rare. This can lead to symptoms such as coolness in the ear, ringing in the ear, and dizziness and sudden ear loss. So the morphological features is good. Glossary evidence red brown colors. That is if it is affecting the heart, lungs. This is when you do the either post-mortem or you can visualize the lungs in a live person. So acute distinct focal areas of hemorrhagic in the alveolar focal necrosis in the alveolar walls, and chronic hemorrhagic leading to interstitial fibrosis and the feeling of alveolar syndrome rather than macromeninges. So this is because of the hemoglobin, hemosyndrome rather than macrophages, and also interstitial fibrosis because of the fibrogen collagen tissues which support the alveolar spaces are affected. So then how do you diagnose Goodpasture syndrome? Goodpasture syndrome, you do urinalysis as a result of the abnormal source blood and protein in the urine. So abnormal red blood cells may be seen, and then you do other follow-up tests like ethyl blood gas, you can do blood urea, and the nitrogen, you can do chest X-ray, you can do creatinine, serum level, you can do lung biopsy, you can do kidney biopsy, you can do blood test like and glomerular basement membrane test, you can do analysis of urine sample for the purpose of kidney function test, you can do chest X-ray to show hemorrhagic pulmonary hemorrhagic, and also you can do pulmonary function test. So the early treatment of Goodpasture syndrome is that early treatment focuses on two things. Number one, you have to focus on rapid removing the antiglomerular basement antibodies from the blood, and also focus on stopping the antiglomerular basement membrane from future production. So for the purpose of removing antibodies from the body, you can do, of course, it's called plasma paralysis. A plasma paralysis, this is where you remove the plasma. It's more of dialysis, and it is those antibodies blood. Blood is moved from the body. So the other one is to stop anti-global resistance members from future production, and this is done by suppressing the person's immune system. And some of the foreign medical is used for this purpose, like corticosteroids, cyclophosphamines, and azathioprine. So, and those are the drugs which do what? Stop the future production of antimicrobial resistant antibodies. So in emergency, hemodialysis is also sometimes necessary, and this errors perform some of the key functions to eliminate waste from the body. So you can do dialysis. So never stiff, in terms of preventing never stiff, use of siphon gas line in your mouth, which exposes the lung to hydrocarbons, solvent, and can cause the disease. And Lord, don't smoke, don't smoke. And then we have other names. This condition is called glomerulonephritis membrane antibody disease. It is also called rapid progressive glomerulonephritis. And also, this is the common one which is used commonly used is called the rapid progressive glomerulonephritis. It's also called pulmonary edema syndrome, and sometimes it is called the glomerulonephritis, a pulmonary hemorrhage. So what are the complications? The complications is like chronic kidney disease. It can also end-stage kidney disease, and also it can cause lung failure. It can cause rapid progressive glomerulonephritis, and also it can cause severe pulmonary hemorrhage. And that is the end of our today's lecture. This is a very good lecture, so you should be able to remember the Goodpasture syndrome, media solution management, prevention, the other names. And that is the end of it. Thank you very much for listening to this lecture.